Let's take a look at Gwen Stefani and see if we can spot hints of facial plastic surgery procedures throughout the years. Stay tuned for the before and after and costs of all the possible procedures at the end. In 1996, at the age of 27, you can see that Gwen has bangs, and it's very common for some of my patients with a high hairline to cover things up with bangs. However, as we know, this is not the case for Gwen, but figured I'd throw that out there. You can see that Gwen has thin eyebrows, and that was in style at that time, but now many people want a fuller look. There is a risk to over plucking the eyebrows in that you can thin them out more permanently if it's done repeatedly over time. Notice that her nose is quite strong with a good bridge and tip, but that fits well with the rest of her face. She has a nice Cupid's bow definition, and she has this upper gum show on smile, and you'll see that persist throughout the years. Gwen also has strong cheekbones and a strong jawline, and that overall helps balance out her nose as well as gives her a nice defined neckline. In 1997, at the age of 28, now we can appreciate Gwen's hairline. It has a more rounded shape to it. It has good proportion of height compared to the rest of her face, and she has these prominent anterior temporal points. You can see that Gwen is overall right side dominant, in that the right side of her face is just her stronger bony structure compared to the left. And even if you look at her chin, you can see that the right side of the chin is bigger than the left. And we always bring this up to point out that everyone has baseline facial asymmetry, and that's very normal. In 1998, at the age of 29, you can see that Gwen has upper tooth show on repose. So when she parts her lips like such, you can see that the teeth are visible. And she has a relatively short philtrum with lip arching. So in my estimation, this is the type of person who wouldn't be a good candidate for a lip lift, because anytime you do a lip lift, you're going to expose more of the upper teeth, and you need to make sure that there's enough distance between the nose and the Cupid's bow to impact change and for it to be worth it for the person. Also, as you do a lip lift, there's more arching that occurs. So for someone who already has an arch type of shape to their upper lip, it's not really good for lifting as far as lip lifts go. In 1999, at the age of 30, what I'm seeing here are some signs of a rhinoplasty. And this is in a way similar to what we talked about with Hailey Bieber, because the slight hump that Gwen has here has been retained, but the lateral osteotomies, or the little bony breaks, were able to reduce the width of her bridge, and I think there were some attempts made to refine the tip of her nose as well. In 2000, at the age of 31, I'm not seeing any changes, and this is the same all the way through 2003. In 2004, at the age of 35, to me, it seems that Gwen may have had a brow lift with or without an upper blepharoplasty. There's increased upper tarsal show, and there's more brow arching, especially as you look more laterally on the brow towards the tail. And she likely started Botox injections around this time to the common areas that we discussed, such as the forehead, the glabella, and the crow's feet. Now, it's possible that she may have had this appearance of a brow lift from just the Botox, but it's unlikely that that created more upper tarsal show. So I think that it's more of a surgical type of brow lift, upper bleph, with some introduction of Botox, as opposed to just Botox alone accounting for these changes. In 2005, at the age of 36, not seeing any further changes, and this is the same all the way through 2009. In 2010, at the age of 41, it seems to me that Gwen may have had another brow lift revision. Or is this just Botox being placed into the brow area as well as the forehead? Now, I think that most likely Gwen had a more surgical type of treatment here, because if she just had Botox that caused the lateral brow to lift up that much, most of the time when that happens, you'll see movement of the lateral frontalis that is still shifting that brow up, meaning that the paralytic has been added to the central forehead and sometimes to the crow's feet without adding it to the lateral brow, and that allows for the lateral brow to move up, but then you'll see lines along the sides of the forehead. In Gwen's case, there are no lines there, so I think that this was likely a surgical lift, and on top of that, she also had the continued Botox injections that allowed the lines to not exist there. So that's why I think this was probably more of a surgical type of impact to her brows. Also, I'm seeing the introduction of cheek and some under eye filler as well. In 2011, at the age of 42, I'm not seeing any further change. In 2012, at the age of 43, there's now the introduction of lip filler. You can see if you look at her upper lip, it's not just straight across as far as the inner portion goes. There is a bit of this kind of waviness to it. So the central area has remained sort of indented in, and then laterally you can see where that filler has settled out. In 2013, at the age of 44, I'm not seeing any further change. In 2014, age 45, she was pregnant around this time, and she does appear to maybe have had veneers sometime around 2013, 2014. The teeth just look different, and they have a different shade to them. They have a slightly different configuration to them as well. In 2015, at the age of 46, I'm not seeing any change, and that's the same with 2016. No further changes. Please make sure to subscribe and turn on all notifications. In 2017, at the age of 48, it looks to me like Gwen has fuller eyebrows. And this to me is likely a combination of makeup as well as microblading, because it looks like there isn't a whole lot of hair all the way through the brows, but I can see the elements of some makeup as well as some microblading throughout as well. In 2018, at the age of 49, it looks like she may have had another temporal brow lift. So this would be revision number 2 to keep those brows elevated, especially on the lateral element of it. And when I look on this picture here, it seems to me that that line that you see faintly might be a sign of a scar. Not sure, obviously, but that is just one idea that I had looking at these images. And I wanted to mention here the risk of shock loss. Anytime you have a surgical incision in or around hair, you always run the risk of shock loss to the hair, which means that it can fall out and it might look thinner here, and then later on I see that it gets a little bit fuller. Now, there are many other reasons for this, but this was just one idea. In 2019, at the age of 50, no further change. However, in 2020, now here she's 51, it looks to me like Gwen may have had a facelift. When I look specifically at the right tragus, so her right side, this tragal area here, to me it seems that that looks much broader and as if the skin was redraped over it and left kind of a larger appearance to the tragus. This to me was likely a deep plane type of facelift with mid-face release, because you can really see in pictures that follow that her nasolabial fold is less pronounced. So most likely some mid-face work was done here as well, and her jawline just looks smoother and tighter here compared to prior. In 2021, at the age of 52, I wanted to just point out with this image here that it looks to me like the lip filler has some asymmetry to it. There's some degree of migration, and when you compare back to like 1996, way before she started lip filler, you can really see the differences that the lip filler brought. In 2022, at the age of 53, to me it seems that Gwen may have had an eyebrow hair transplant. Especially look when you compare back to 2020, you can see the difference. It looks a lot more natural, as if there's actually hair there throughout the brow compared to what I saw prior. Now, this could just be the work of some really good microblading giving this effect, but it's also possible that an eyebrow hair transplant may have occurred. The total cost of all these potential procedures is $428,000, and here's the before and after. Since you like this video on Gwen Stefani, I know you'll love our video covering Renee Zellweger. Click on the card and I'll see you there.